a new USMLE question. But first, before we start, if you're not subscribed, click subscribe button now and don't forget to leave a like. Now what we have in this question. A 72-year-old male with a history of coronary artery disease and high cholesterol presents to his doctor with a 4-day history of fever, productive cough, and malaise. His regular medications include daily atorvastatin and low-dose aspirin. On examination, he has crackles in the right lower lung field. A chest x-ray confirms a diagnosis of community-acquired pneumonia. The physician plans to start him on a course of clarithromycin. Given the patient's medication list, which of the following potential adverse drug reactions is the most critical to consider before prescribing clarithromycin? Is it A. Acute kidney injury from aspirin, or B. Significant QT prolongation, or C. Elevation of liver enzymes, or D. Increased risk of gastrointestinal ulceration, or E. rhabdomyolysis? So what do we have in here? A 72-year-old man with history of two significant and important criteria. Now we have here a coronary artery disease and high cholesterol. Especially coronary artery disease is caused by high cholesterol. So what is the rate limiting step in cholesterol synthesis? It's HMG-CoA reductase enzyme. If we could stop this enzyme, we would significantly decrease the cholesterol synthesis, treating coronary artery disease. Which drugs are used to decrease or inhibit the synthesis of cholesterol? It's the statin family. Here, our patient takes atorvastatin daily. Atorvastatin is a long-acting statin, which, as we said, inhibits HMG-CoA reductase enzyme, decreasing the synthesis of cholesterol and treating coronary artery disease. He also takes low-dose aspirin. Now, after the physician diagnosed our patient, he found that he had community-acquired pneumonia, and he tries or prescribes him clarithromycin. What is clarithromycin? It's an antibiotic which is very common for inhibiting hepatic microsomal enzymes, especially cytochrome B450, which is a very important enzyme. So what we have now, when our patient takes clarithromycin, it's going to inhibit cytochrome enzymes. Cytochrome enzymes are enzymes in the liver that break down different drugs or chemicals in order to be excreted from the body. Now, when we take clarithromycin, we decrease the metabolism and the excretion of different drugs, then different adverse effects will appear, especially with lots of different drugs, but one of our statins here is metabolized by cytochrome B450. Then, when the patient takes clarithromycin, his statin levels in his blood will increase. Now we have different adverse effect of statins. As we said, this is the same question, the same things here. After taking clarithromycin, our statins will increase. What about aspirin? Aspirin will slightly increase, but remember, the patient takes low-dose aspirin, so it's not going to be significant. The effects of aspirin could be actually causing gastrointestinal ulceration, which is choice D. But now we have low-dose aspirin, and aspirin is not mainly metabolized. It's partially metabolized by the hepatic microsomal enzymes, so this is not the correct answer. As we said, taking clarithromycin will cause increased statins. Then what are the adverse effects of statins? We have lots of different adverse effects, but the most important two are myopathy, rhabdomyolysis with liver disease or increasing liver enzymes. We now here have all the different adverse effects of statins, but as we said, the most important one are rhabdomyolysis. Then we return back to our question, the same question as we said before, and here are the choices. Is it acute kidney injury from aspirin? No. We said aspirin is not by cytochrome B450. Is it significant QT prolongation? It's not very common with statins. Elevated liver enzymes might be correct. Increased gastrointestinal ulceration is not correct, as we said. And the last choice is rhabdomyolysis. Now we have two possible choices. Is it elevated liver enzymes or rhabdomyolysis? Here we have an old man, and the most critical adverse effect here is rhabdomyolysis. You must notice that the most important adverse effect of statins is rhabdomyolysis. So the correct answer here will be, after all these highlights, is rhabdomyolysis choice E. Now we have an extra question for you. Try to solve this question. Leave your answer in the comments. I will give a heart if you had the correct answer. If you got it wrong, I'll give you a hint to answer this question. Don't forget to leave a like and subscribe to our channel.